Oh, it was beyond my expectations. We had a sold out standing room only crowd. I think there was probably about 100 people there. And I thought maybe we'd have five. And so I presented, the AI operating system for ophthalmology, which is really EVAA, but I was really talking about, how AI has evolved. I started my career in AI in 1987. I built one of the first expert systems on Earth. And all of that AI kind of disappeared for a while, but it really didn't disappear. It was just in development for many years. The last 40 years, AI has been evolving, maturing, and today it's becoming ubiquitous in our daily lives. And to see as many ophthalmologists in one room with the kind of interest that we got was very heartening and mind-blowing, actually. And really the opportunity today with AI and ophthalmology is really enhancing patient care and reducing staff burnout. I think this is where AI can make a huge difference. But that's kind of how I'm feeling. Very ecstatic. EVAA can be a great assistant to these offices, right? First of all, it runs 24/7, right? It's inexpensive. I mean, one of the ophthalmologists that was in the booth was saying, hey, some of the people are just data entering right now, right? They're not doing patient care. We need to free them up to do patient care and not do data entry in their EHRs, because that's just a dumb job, right? So let EVAA do the dumb job, but EVAA is not dumb, EVAA is smart. It can be a smart data entry. You can do a lot of the data entry. It can take out a lot of things that you need, right now you use staff people to do. And so I think it's really going to be a great augment to an office. I don't think it's going to replace the staff. They're still going to need human beings to interact with the patient. I think it's going to just do things that are repetitive, that are unnecessary for staff to do. It's almost like going back to the world of paper, where when you went and saw the technician, that was more face-to-face, right? You're talking to people and not doing this. It's about removing this, right? And their workload they're burdened by all this insurance stuff and all this coding and all these complicated things that have been created to control the reimbursement. A lot of that, all that minutia work can be done by AI. So again, you're freed up to focus on the patient and look at the patient in the eye and provide them with the care. So ASCRS has been a great show for us. We've been just jam-packed since this morning. It's been nonstop. And I think we have really an exciting opportunity to help the ophthalmology, the optometry, the whole eye care community with EVAA. I think EVAA is going to be there's so many people just coming up and just picking up the glasses. So they're drawn to us. They're drawn to EVAA. They're drawn to our brand. And what's most importantly, they're drawn to how we plan to solve the problem. It's really hit home in their heart. I think all of them have been popular, but of course the Scribe. I think the Scribe is like the killer app. But there have been so many people who said, well, yeah, I would love to just handle the voicemailing. Oh, and they love the on the billing side, the eligibility part of it, right? It's a big piece of it where they have staff just calling, right? Billing people just calling for eligibility information. Well, eligibility basically, when the patient calls in, makes the appointment, provides the insurance information, we need to validate what they're eligible, what their benefits are for the insurance that they have, so that we can make sure that we provide those services and that they're eligible for. I mean, that alone is time consuming. And if you do make a mistake there and you submit things that they're not eligible, their claims are going to get declined, right? And there's all these minutia things that you have to do about the insurance claim, that if you don't have eligibility information, you're likely to not submit the right claim, and then your claim gets denied, and then your reimbursement gets delayed. And if you don't solve that problem in a timely manner, you lose the reimbursement. That's what the eligibility will solve. So yeah, ASCRS has been a great show, and we will come back again next year.